Did you know that in 2024, nearly 11.8% of all healthcare claims were initially denied? That is a steady increase of 2.55% from the previous year. Each of those denials slows down reimbursements, create administrative backlogs, and cost healthcare organizations thousands of dollars each month. To manage this growing issue efficiently, providers need to understand the reasons behind each denial, starting with what denial codes actually are. Denial codes are identifiers sent by insurance companies when a claim has an error or an issue. The code tells billing staff exactly what went wrong so it can be corrected. There are two main categories of denial codes. The first are CO codes, which stands for Contractually Obligated. These mean that the issue is on the payer side and the insurance company needs to fix the error or follow the agreed upon payment term. The second are PR codes, which stands for Patient Responsibility. When a PR code appears, patient responsibility falls on the patient once the issue is corrected. One of the most common and often misunderstood denial codes is CO96. This code indicates that the insurance company believes that there is a non-covered charge on the bill. In other words, the payer considers the service not part of the patient's coverage. It does not necessarily mean the service was billed incorrectly. Rather, the insurer has determined that it is not covered under the patient's plan. Denial code CO96 comes from the Claim Adjustment Reason Code Systems, or CARC, which is a standardized list created by the insurance industry to explain why a claim or service line was adjusted, reduced, or denied. Understanding this code is important because it directly affects how and when providers get paid. CO96 points to a coverage issue, not a documentation or billing error. There are several common reasons for denial code CO96. The most frequent one is non-covered services, which happens when a procedure, supply, or service simply is not included in the patient's policy. In those cases, since the denial is labeled as a CO code, the provider cannot bill the patient for it. Another major cause is incorrect coding. Sometimes the service would be covered under the plan, but it was just coded incorrectly. For example, if the diagnostic code does not align with the procedure code, or if a required modifier is missing, the claim is automatically flagged as non-covered. Coverage discrepancies across different insurance companies can also lead to CO96 denials. Each payer has its own medically necessary guidelines, and they do not always match. A service approved by one insurer might be declined by another simply because their internal policies differ. Essentially, the payer is saying they recognize the service was performed, but based on their rules, they cannot reimburse you for it. Even though you cannot completely avoid CO96 denials, you can minimize their impact by responding quickly and methodically. When your organization receives one, start by reviewing the patient's benefits to verify whether the service should be covered. Next, identify what is wrong with the claim, whether it is coding, missing documentation, or a coverage mismatch. Then verify the denial reason directly with the payer to confirm their explanation. Once you have identified the issue, take corrective action, such as adjusting the code, adding missing modifiers, or providing documentation to prove medical necessity. After that, resubmit the corrected claim. If the payer still rejects it and you believe the denial was made in error, submit an appeal with supporting evidence. But consistently reviewing denials like CO96 and understanding why they occur, healthcare organizations can improve their revenue cycle performance, reduce turnaround times, and prevent the same mistakes from happening again. Knowing how to interpret and respond to these codes not only streamlines reimbursement, but also helps keep the focus where it belongs, on providing quality patient care. If you'd like to learn more about how to manage your denial codes, reach out to Etactics. And since you made it this far into the video, you might as well like it, share it, and comment down below.